morning, everyone. Thank you, Mark, for the introduction. So, as mentioned, I'm coming from a neighboring unit to the health unit, so digital social platforms as the unit relevant for this forum. So, my presentation will be more focused on our topics than health topics, but then I will present the link. So, our unit is financing projects that are tackling three issues related to aging. So we want to create sustainable, long-term and healthcare regimes for the elderly, financially sustainable, so that the governments can sustain a service. We want to improve the health conditions and quality of health for the elderly. And we want to create opportunities for the industry that is supplying the services and products for AL. So in the past, we've been financing FP7 projects. We had 35 projects from FP7, some 125 millions were distributed. And of course, H2020 is a continuation of these efforts. The topics that we have been supporting are smart environments, support of cognitive abilities, robotics, service robotics, and various platforms and open system architectures. Also supported road mapping and standardization and international cooperation from FP7. CIP. That's Competitiveness and Innovation Program is financing United for Health. I think it's a budget of 8+8 million altogether. The CIP is also absorbed by H2020, so will continue in the period 2014-2020. And of course, CIP was about a large-scale deployment of tested prototypes, let's say. The topics were multiple chronic diseases, cognitive impairment, integrated care, fall prevention, and skills and cares, basically mirroring the topics from FP7, however, closer to the market, closer to the deployment. I'm sure you know this program, AL1. So we had 25 million each year from the Commission, up to 25 from the participating countries. And the advantage of this program, as you know, is that the national rules for participations apply. And there you go with the 6 topics of the first program. I'm sure you are all familiar with that. So now, talking about the present and future, H2020 is a successor of CIP FP7, and also there is a bit coming from the European Institute of Innovation and Technology. The difference between FP7 and H2020 is that we want to basically create more links between research and innovation to help to deliver the solutions to the market. The focus is also less on technologies, more on societal problems, like aging, for example. And so the topics are gathered by societal challenge. And there's a simplified access to finance. So in H2020 we have less of demands on some administrative requirements. The budget of the challenge health, demographic aging, demographic change and well-being is 7.5 billion for the period 2014-2020. And yes, so the important point is that the research results that are there are now being translated and delivered to the citizens. So among other, again, we want to support the objectives of the triple win, then improving the health, improving sustainability, and creating more business opportunities. So our unit, H2, had these following objectives in the first call of H2020. So as I said, we are supporting robotics in smart environments, also other solutions for independent living with cognitive impairments. Early risk detection and intervention, and also we promoted some coordination activities through this last call. The call was closed in April, it was evaluated in June, and next week, on Monday, we'll send out the results.
News.
Applause. Okay, I've been working on with Peter Windlev Jensen on AL2 the whole last year, this year. And so we are rolling out this program again successfully, and yeah, we had a first call, Care for the Future, and yeah, I think the evaluation was following about the same schedule, and the countries that are participating in this call is a subset of the participating states. But we hope for more countries to get on board for Call 2 next year. Switzerland is an exception. It's a country that is financing 100% of the projects because of the bilateral agreement between EU and Switzerland that doesn't allow financing H2020 projects so far, maybe next year. Now, I would like to talk about horizontal activity, let's say, or activity that is not engaging financing, but is more of coordination activity, let's say. European Innovation Partnership on Active and Healthy Aging. So it's a grouping of again, all the stakeholders surrounding AEL, and it's building on a current or past commitments, and there are new commitments also within this activity. And usually high-level political backing is needed for these projects or for these activities because it usually entails large-scale validation. This platform is also serves as a forum for exchange of best practices. The EIP is standing on 3 pillars. So there are three major topics that it's trying to develop, and it's care and cure, innovation and prevention and early diagnosis, and the last one is the one most relevant for our forum, and it's innovation and active and independent living. Then there is a horizontal activity, so EIP is a framework, conditions and evidence. So that's quite important as well to develop methodology for delivering 2 healthy life years, etc. So this is a process how it works. We have currently these 6 action groups, and there are more than 1,000 regions already on board, with some 3,000 partners and 30 million citizens covered by these projects and partners. So EIP is picking up the best practices from all this experience and all this knowledge, and strives to replicate it or to scale up and transfer the knowledge to regions that want to develop and follow the leaders, let's say. And this is also, the slide shows how it's done. We are creating a database of good practices. We are also assessing the viability of good practices for scaling up. So there's a quality assessment of all this information. There's a work in EIP. There's a work on classification of the practices also, and it's a forum basically to facilitate the scaling up. All right. So this is the end of my presentation. If you need more information, please follow the digital agenda website for Europe. And maybe you wanted to mention something about digital agenda also in this context.
Thank you, Jan. Thank you for this. Just a quick word. In 2011, 2012, the European Commission defined a digital agenda for Europe. You are all familiar with that, most probably, and a number of key actions have been listed. One of them, and this is an important element that has been motivating, or that is in fact some kind of the legal base, if we can use that, or the political base of United for Health. In this digital agenda, the European Commission has set several priority lines, key actions. One of them is ensuring large-scale deployment of telemedicine services by 2020. So United for Health is aiming at contributing, providing content, providing experience, and serving as a good set of good practices too, to push in that, to contribute to achieve that objective of the European Commission.
Okay, thank you.
Thank you, Jan. Thank you, Jan.